go through them in order, and then we'll see how long that takes us. And if there are follow-up questions and if there is time, I'll be happy to answer those as well. We'll just give it like 1 more minute and see if anybody comes in, and then we will get started. I think this is going to be pretty cool for you guys and for us, because we're each going to take a week out of the month and have a regular Q&A session. Different people will do them on different days, so that will help for people who live in different places or have different schedules. Some of them will be, easier for some people to log into, and other ones will hopefully be easier for people who can't do like this time on Thursdays. But we'll have pretty regular time scheduled. And then I'll do 1 week, Heather will do 1 week, Amy will do 1 week, and Carrie will do 1 week. So there will be coverage. Hi, Serena. I have you join. Hi, Serena. You don't have to turn on your camera if you don't want to. I was waiting to see if more people were going to join, just kind of like introducing this as the first of this new series of Q&A sessions, saying that we're each going to do 1 week. So I think I'm kicking it off with the first one, and I'm always going to be in the first week of the month. And then Amy will do a week, Heather will do a week, Carrie will do a week, and I'll do a week, so that there will be Q&As in pretty much every week, except when there's like a weird 5-week month, maybe we'll have a week that we skip. And they'll be scattered throughout the week. So mine will almost always be Thursday mornings at 9. And if that's a time that works for people, there'll be people who can easily attend this one. But for people that this doesn't work for, the time Heather does and the time Carrie does and the days will all be different, so that there'll be more coverage that way, to the extent that we can do that. I have prepped all the questions that were asked in advance, and I'm just going to start at the top of the list and answer them in order. And then, because it's the first time, we'll see kind of like how far that takes us. There weren't as many questions for this session as I expect there will be in the future, because we have to get used to this and people have to remember to ask questions in the Q&As and feel comfortable with that and everything. But if there are any follow-ups after I finish answering the questions that were asked in advance, and if there is time left, then I will go ahead and I'll be happy to take those either from you like on the Zoom or in the chat, whatever works for you. So it's almost 5 after, so we're just going to get started. It is nice to see you guys. The first question that I got was really sad. I just found out that my pregnancy is not progressing. My RE pushes for a D&C. I would rather pass it on my own. What are your thoughts? So the first thing, of course, is that it's just so sad when a pregnancy isn't progressing. I'm really, really sorry. I wish that we didn't see this happen as often as we do. The fact that it's fairly common and something that a lot of people in this community have experience with makes it something that's not alarming, because it's rare and unusual, but it doesn't take any of the sting, the disappointment, the fear, the sadness. Like it doesn't, nothing makes it better. So I am really sorry. A D&C versus passing naturally versus using medication potentially to try to speed up the loss of the tissue. There are pros and cons to all of these options, and it is hard to give a definitive answer, even to a girl that I'm coaching with and know all the details really intimately, because nothing is sort of guaranteed to be the best perfect option. The fear with a D&C is that there could be scar tissue, or that there could be difficulties in thickening a lining, things like that, after you've had a D&C that could impact a future pregnancy. And that is true. That is one of the risks, one of the potential risks of a D&C. I would also say that I really don't see that happen from D&Cs, and I do see people have D&Cs very frequently. I also have had many girls over the years who've had multiple D&Cs, 2, 3, 4 D&Cs, and I haven't seen an increase in scar tissue or other issues related to those. The other thing is that if you were to have any scar tissue, doing a D&C is actually one of the ways that they might treat it. So it is, you know, a little confusing that it could cause scar tissue, but it also is a way to try to remove scar tissue. So what I typically say is that a D&C is going to be the fastest way to deal with things. You will go into the doctor, you will be given some local anesthetic or potentially even twilight if you ask for it, or if that's what they typically do. And they will do a pretty brief procedure, and then they will remove most of the tissue from your body at the time. This is the best way to get testing done on the material. So if there are any questions or concerns about whether there was a chromosomally abnormal embryo, this is the best way to get that tissue. You can get a home collection kit, or you can even just, you know, kind of collect it on your own in like a clean Ziploc bag or something like that. But it is harder to get a complete sample that can be tested, that can show results. And then you're also in a situation of having to like refrigerate that and transport it and get it to a doctor and so on and so forth. So for testing purposes, a D&C is preferred. For moving fast, a D&C is definitely going to be faster. Having that tissue leave your body all at once is part of what will help your HCG to drop faster. And what brings your body back to its sort of pre-pregnancy state is not just the removal of the tissue passing from your body in whatever way you choose. It's also that then your body responds to the tissue being gone by returning all of your hormones to a pre-pregnancy state. And the primary one that, depending upon how high your beta has risen by the time that you lose the pregnancy, the primary one that we tend to be waiting for in many cases is for the HCG to return to 0. So a D&C is expedient. That's why your doctor is interested in it. If you have any history of having had a natural loss at home and having had it go fairly fast and complete, then you could feel more comfortable doing it on your own. If you are very early in the pregnancy and you have just found out that things are not progressing and your body really hasn't had a chance to try to do it on its own, your beta was still rising only a day or 2 ago, and now it has started to drop. That type of thing, you can give your body a chance to do it on its own because it hasn't shown itself to be lagging, to be slow, to be delayed. If you've been doing betas, doing an ultrasound, double checking, making sure that everything was definitely not progressing, and a week or more has passed and your body isn't really showing any signs of moving forward, then a D&C starts to make more sense than doing it naturally, because we don't know how long it will take your body to pass the tissue naturally, and we don't want it to be an unusual delay. So a week or 2 to sort of process all of this out of your body is pretty normal. There are occasions where it doesn't end up happening for a month or more, and that it delays everything for you, but it also can potentially have some risks. That's why there are pros and cons to all of these different choices. So I literally just had a girl last week whose doctor wanted her to have a D&C on Thursday, and she was uncertain. She didn't know if she wanted to go ahead with it. The doctor offered her 2 other options. She could take the weekend, Friday, Saturday, Sunday, to see if everything would pass naturally, and then come back in on Monday for the D&C, or she could take a vaginal kind of like suppository medication. One of the brands is called Cervidil. It basically helps your cervix to open, and it is one of the two drugs that combined is what makes a medical abortion. One is misoprostol and one is mifepristone, and I always have like a mental block about which one is which because their names are so similar. But the one that they were offering her was a drug that would cause your cervix to dilate, which would sort of help progress the passage of the tissue out. It wasn't the drug that would cause the contractions in the uterus. But certainly you could also be offered that medication as well. It's just kind of assumed that your body doesn't need that because it knows that the pregnancy isn't continuing and it is going to, start acting on that. So she opted to give it the weekend and see what happens. And the doctor asked her to take the vaginal suppository on Sunday night, coming in on Monday for a D&C if things hadn't passed. And then she started to bleed on Saturday, and she actually had a pretty normal, pretty uneventful loss, but it still was a pretty awful Saturday where she was at home and she was bleeding, and sometimes it feels like a lot of blood, and she's very, very sad and hurt. She did take the cervical medication on Sunday night as she'd been instructed. And when she went in on Monday, they did a sonogram and they saw that pretty much everything had passed on its own. Over the weekend, there was one little clot that they could visualize. And by the time she got home, she had passed that clot. And so she's only spotting like a very small amount in these days after Monday. And basically the whole event kind of is over. She has had another loss in the past that didn't go as quickly. And so that I think is why her doctor was hoping she would do the D&C, although her body proved itself to not need it in this case. So I always say that it's really up to you. If you feel like this just has to end, you can't wrap your head and your heart around sitting around for 3 days, 5 days, 7 days or more, wondering when you're going to start to bleed, and you don't feel like you can put the rest of your life on hold, whether it's your job or a vacation or taking care of another child or, anything, to have a day or two where you kind of need to suddenly be at home because you're having a miscarriage, then choose the D&C and don't feel bad about it. Don't feel too worried about the risk of scar tissue. The doctors do these procedures all the time. They are very safe. If you have a weekend coming up and you don't want to opt for the D&C and you don't want to do it right away, you want to give your body a chance to do it, then don't do it. Take the weekend, ask your doctor to give you the weekend, set something up like this patient did, where there's another date where you're going to go in and get checked. And you guys have a plan for what happens next if nothing happens during that time. And of course, if you want to have the tissue tested, then I think you need to opt for the D&C. So I hope that helps. I don't think these decisions are never easy, and you're never in a good headspace, heart space to make them. So it is okay for some of your emotions to kind of, be part of your decision making, because we have to honor our emotions and we have to take care of our hearts too. So the second question that I got is, how soon after miscarriage can I try to conceive? So what's going to happen in a miscarriage is that you're going to pass the tissue that was the beginning of a pregnancy. And as I said, in a D&C, a lot of that can get taken out all at once. And so the experience of passing it should be relatively minor. But as I described with the girl that I just had experienced this over the weekend, if you have a natural miscarriage because it just spontaneously happens, or because that's what you choose to wait for, it can take a few days to pass quite a bit of the tissue. It really can vary. Most of the time, girls will have a day where they pass it all together, almost all of it. But sometimes it'll seem like you've passed a lot of it, and then a day or 2 or 3 will go by and you'll pass a whole bunch more. It can be a little bit unpredictable. But you do have to pass all of that tissue in order to kind of start the clock on thinking about when you can try to conceive again. So after a miscarriage, it is really important to go in and get checked, just like my patient did, to see if on an ultrasound sonogram they can see that all the tissue has passed. Because even just a little tiny bit of it remaining in like a little corner of your uterus can continue to pump out hormones or cause your body to pump out hormones that are only elevated during pregnancy, and that will keep you spotting usually, and it will also keep you from ovulating. So the next thing that happens, we've seen that the tissue has been fully passed, you've had a sonogram, everything looks really great. We do want to monitor how your HCG goes down. And it's the opposite of the really happy, exciting thing that we do in early pregnancy, where we monitor how the HCG goes up. We're not looking for any specific amount of reduction, the same way that we're looking for kind of like a benchmark in early pregnancy of ideally something doubling kind of every 2 days in those early days. But what we are looking for on the HCG dropping is for it to consistently drop and for it to drop fast enough. So how fast it's going to drop and how long it's going to take for it to drop all the way to 0 is going to matter. It's going to be based on how high it was to begin with. So if it was a very early loss and it was only in the like 1200, 1500, 2000 range, things are going to go faster. If you were a few more weeks along and you were in the tens of thousands or 100,000s, it's going to take longer. The higher the HCG is, or the higher numbers will drop faster in the beginning. So it's not a change that is consistent in rate throughout your experience of tracking your HCG. When you have 100,000 or 50,000 in 1 week, it's easily going to drop like a lot. It could go from 100,000 to 50,000 or to 20,000 or to 10,000 in 1 week. And if you have a D&C or if you have a miscarriage where the tissue really like completely comes out very quickly and efficiently, that could help it to drop more quickly in the beginning. But as everybody approaches 0 again, the rate that it drops slows down. So when you get to like a 20, if you got your HCG tested and last week it was like 100 or 120 and now it's 20, you might think, okay, so by next week this is totally over. By the next time I go in to get this tested again, I'll be at 0. But that's not really how it works when it's in the low numbers. So if you had a 20 this week, I would be expecting that it would hopefully be below 10 next week, but I wouldn't really be expecting it to be at 0. And I wouldn't think that that means that there's anything wrong. It just slows down as it gets into those later, those smaller numbers. By the time you hit a number that's below 10, I do pretty much expect that the next week it's going to be 0 or really close to 0. It doesn't have to literally be 0 for us to be comfortable that this kind of period of loss is now ended and now you've entered into the next stage, which is, what happens after a loss. Your body has to have an HCG of below 5 for you to ovulate. So that's kind of where it doesn't have to be 0, but we definitely want to see it in like the 2-ish range. We want it to be well below 5. So now you've passed the tissue and your HCG has returned to a pre-pregnancy level. So your body is ready to move forward. It's ready to return to a pre-pregnancy state. And so the next thing we're going to be waiting for is for you to get a period. And it is not certain when you're going to get that period. The most common time frame for you to get that period is 4 to 6 weeks. But the question is, how quickly is your body going to ovulate, or is your body going to ovulate first before you get a period? And everybody's body is a little bit different, and they respond to these changes in hormones and losing a pregnancy in different ways, and all of that is normal. So it's not like if it takes 6 weeks, we're concerned. If it took 4 weeks, it's expedient, it's fast, it's easy, right? So we prefer that, just emotionally and kind of like schedule wise, it's something more sort of like predictable, easier for us to handle. But 6 weeks is not a health problem. It's totally normal and totally fine. So what usually will happen is that your body will progress into a follicular phase and develop a follicle and ovulate an egg, and then you will have not tried to get pregnant because your doctor will have probably instructed you that you shouldn't, and you probably won't have known exactly when you're going to ovulate either. And then you will have a luteal phase, and then you will not be pregnant, so you will get a period, and then you will start another cycle. And that's like the first full cycle after your miscarriage. In some cases, the way that some people's bodies work, they just kick off and they immediately start growing that follicle, as if the return to an HCG below 5 was a period, right? Okay, and I get a period and then I start growing a follicle. But in other people's bodies, it can take another week or two, or occasionally a little bit longer, for your body to like adjust and be like, okay, now we can start growing a follicle. And in a few cases, the girl may actually bleed sooner. She may get a bleed in like 2 or 3 weeks, where we know there hasn't been enough time for there to be an ovulation. And that may be just her body resetting. And then it's going into a full cycle after the loss. So it used to be the case that doctors would say that you should go through that period and you should get the bleed. That means that we've started the first full cycle after the miscarriage, and you should wait again. And then in the next one, so after you've gotten 2 periods, then you could start to try to get pregnant. But nowadays, as long as there's nothing else unusual going on, once you get that period, you really can start trying at ovulation in that first cycle, as long as you're ready to try. Depending upon whether it's your first loss, whether it was super early, there are other factors where sometimes women are not ready to try, and that's completely okay. You can take a month or 2 or more if you need to kind of get your head and your heart ready to try again, because getting a positive pregnancy test is harder after you've had a loss. So hopefully that answers your question. I would say once you get a full period and you're in a new cycle after having had the loss, then you can start trying again. The next question I got is much less heavy, much easier to answer, much fewer details. What's the ideal amount of acupuncture sessions? She says weekly acupuncture sessions. So I would say acupuncture is awesome. I love acupuncture. And one of the coolest things about acupuncture is that you can never have too much. You are never going to harm yourself by having more acupuncture. That being said, also, it is long lasting. It has impact on your body beyond the moment that the needles are in, or the 24 hours after the needles have been removed. So I always say, as an acupuncturist, that I can work with almost any schedule. I love 1 appointment per week. I love that because it has consistency, it has regularity, your body gets a lot of opportunities to respond. And because of the changes that happen within a menstrual cycle, we can address things that are more specific to the follicular phase, more specific to ovulation, more specific to the luteal phase, and more specific to early pregnancy or a period. If you are typically going weekly, I think that's great. If you go weekly, but you have a vacation or you have a really busy week at work or something like that, and you need to skip an appointment, that should be fine. It should not derail the progress with the acupuncture at all. It should be completely fine. If you can go or want to go more often than weekly, you certainly can. There are some people that I see twice a week. And sometimes that's a consistent thing where I see them twice a week all the time. Sometimes that's a consistent thing for a short period of time, like the first 4 weeks or 6 weeks or 8 weeks of working with them. Sometimes it is a sporadic thing. I see them usually weekly, or I alternate kind of, sometimes I see them weekly, sometimes I see them twice a week. And it depends in part on their schedule and in part on what's going on in their bodies. So the reasons that I might see someone for 2 weeks for a short period of time, a month, 2 months in the beginning, would be that their cycles are super irregular, or their menstrual symptoms are very uncomfortable, or they have a lot of like super dark, chunky clots in their menstrual blood, or they have a tremendous amount of anxiety and fear, and they really need support. So it can be a physical manifestation. It can be a mental, emotional manifestation. It also has to do with their response to acupuncture. You know, if the girl doesn't like getting the needles put in, if they feel sharp to her, because everybody feels things differently, no matter how gentle I'm being, if they feel sharp to her, if she has anxiety around lying still with the needles in, if she like gets anxious for the appointment, then I don't think coming twice a week is going to be better for her. I think we should do a little bit less, but in a much more supportive and like comforting way, so that we can make those appointments less anxiety provoking, less uncomfortable, so that she's now not dreading them but looking forward to them. And then of course we could add in more sessions afterwards. But there are a lot of people who have anxiety already prior to getting pregnant, or have depression, or have like ADHD, or other issues, or maybe they have another physical issue, like they have a ton of upper back pain, or they have a really, really bad knee. And coming twice a week is a way that I can spend one appointment really focused on the fertility aspects, and one appointment focused on the knee or the upper back, something like that. Or just, this is the thing that she does that like keeps her stress hormones and kind of like feeling really good. Now, if this is freaking you out because you're thinking, I don't have the time or the money to come once a week, and now you're telling me I need to come twice a week, that's not true. You could come every other week, and that would be fine. It's great. I have a ton of patients who come every other week, so I have no problem with that at all. Every other week is a really good amount of time, because when we're doing fertility, because we can have one appointment in the follicular phase and one appointment in the luteal phase, one pre-ovulation, one post-ovulation. And if you live far away from an acupuncturist, or you have, you know, money constraints or other things, and you can't come as often as every other week, I can still work with you. I can see you once a month. I can see you once every 2 or 3 months. Usually when I'm doing that, things are progressing much slower, but occasionally I'm sharing the patient with a local acupuncturist. I'm the fertility expert acupuncturist, and I'm doing things beyond just the time with the needles in the room. And she has a local acupuncturist who she's seen previously for her knee pain, or her husband saw for his low back pain, or, you know, whatever it was. And maybe she sees that person 3 times a week, and me 3 times a month, and me once a month. Or maybe she alternates seeing me every other week, then she sees him 2 weeks later, then she sees me 2 weeks later, so on and so forth. You can do almost anything. In an ideal world, I think everyone would have the time and the resources to come once a week. And in some cases, twice a week. And in some cases, once a week would be too much, so they'd come every other week. So that would be the ideal parameters, would be between every other week and twice a week. Hopefully that helps. Is there a probiotic that you recommend, and what are your thoughts on spore probiotics? There are probiotics that I recommend. There are many more probiotics out there that are totally fine. Us recommending one doesn't make everything else bad, but there are also a lot of pretty crappy quality supplements in general, and probiotics have burst onto the scene, you know, in the last like 10-ish years as this pretty simple type of supplementation that, you know, everybody's gotten into the game on, including like the yogurt makers and everything. So there are a lot of really crappy probiotics. I'll answer the spore probiotic question second. Which probiotic is best for you is going to depend upon you. So if you are a person who hasn't taken any probiotics before, I will generally start you out simple and small, and maybe start you with something very simple that is just a single strain probiotic like Culturelle. Most people tolerate Culturelle really well. If you are a person who is having like an acute gastrointestinal issue, it's not your normal way of living, but you just went on a trip, or you've just had kind of like a stomach flu, or even if you weren't sick, you've just had something happen where now you're having like looser poops and more bloating or diarrhea or stinky gas or something like that, I might start you on a different single strain probiotic like a bifidobacterium. So like Florastore is a brand that I might use. And that one I probably wouldn't keep you on forever. There are some people who will stay on that for a very long time, but most people will probably take it for 1 or 2 months while their body is dealing with whatever they caught in Mexico or whatever. And then once you're feeling mostly better from that, we'll switch you to something else. Similarly with the Culturelle, it's not because it's addressing something simple, it's just easing you in, making sure you don't have any side effects to taking a probiotic regularly. Once you've been on that for a month or 2, I'll probably switch you up to a more multi-strain probiotic. So what are the reasons why I might start you slow with Culturelle before moving you up to a multi-strain probiotic? Some people don't do so great with probiotics. Sometimes it's a really simple thing where they need the right blend. Probiotics can make people who trend towards constipation more constipated. So in that case, assuming everything is pretty normal, one of the probiotics that I think works the best for people who trend towards constipation is Seed. Seed is really great. And most of my girls and guys who have constipation find that it eases the constipation and it makes things much easier. So if that's kind of the profile that you have, that would be one that I would try next. If that's not your issue, Innate Response or Mega Foods, that's the same brand. They just have like a professional labeling and a retail labeling. They have a series of probiotics. They I think they're called Flora, and then the number that comes afterwards is about how many billions of bacteria are in the dose of the probiotics. So they make a 5-14. That means there's 5 billion of 14 different strains. They make a 20-14. They make a 50-14. They make another one too. And so I think 5 billion is kind of too low of a daily dose. 10 billion is where I would start. And so I mostly start people on the Flora 2014 because you can take 1 pill instead of having to take 2 or 3 or 4 of the 5-14. So it's going to be more cost effective. That is a probiotic that has to be kept in the fridge. So if you need a probiotic that doesn't have to be kept in the fridge, that's not going to be the right one for you, but that is a really good probiotic. Another reason why someone might have some issues taking probiotics is if you have SIBO. People who have SIBO, the traditional probiotics that work for everybody else can actually aggravate their SIBO. So if you start taking a probiotic and you start having a lot of symptoms and you start feeling really gross, that could be a sign that you have SIBO. It's not guaranteed because it could also just be that your gut, microbiome is really struggling, or that, you have some other sort of like immune issues going on. Your body is more delicate in a way. So what's really great for you guys specifically is that as part of this program, you do that GI map testing and you meet with Carrie and you discuss all of that. So she we'll be able to put you on more targeted, specific probiotics to deal with the specific overgrowths and undergrowths and issues that are identified in your GI map testing. So for you guys, I would always defer to what she has you on, and I wouldn't start adding another probiotic on top of your GI protocol. I would do the protocol that she gives you without another probiotic unless she has cleared it. And then I would only start another sort of general probiotic after that GI protocol is over. And since you have access to her, I would ask her which one she would recommend, because it can be more tailored to you without you having to do a little trial and error, which girls who don't do the GI map and don't have that experience will have to do a little bit more trial and error. So now we can get to the second question on spore probiotics. Fermented foods are a really great way to get microorganisms, healthy microorganisms, into your digestive system. As long as you're not someone who has a histamine sensitivity, you can be eating freshly fermented sauerkraut, you can be eating freshly fermented kimchi, you can be eating freshly fermented pickles, you can be doing a reasonable amount of like high quality fresh kombucha. It has some alcohol in it, it has some sugar in it, so there's some other things that we have to manage there in terms of like quantity and frequency. If you're okay with dairy, you could be doing like a fresh kefir, something that is pretty potently fermented and alive. I wouldn't trust most yogurts from the supermarket, even though they might be yummy. Your chobani takes a long time to get to you from the time that it is fermented into what it is, and so the amount of living bacteria that's in it is probably not therapeutic by the time that you get it. But those are things that you can do, that you can probably do while you're doing your GI map protocol, unless it has specific dietary restrictions that go along with it, that will also help to boost your healthy microbiome in your gut. The one caveat there is if you are histamine sensitive, those fermented foods are high histamine, and so sometimes you can't have any of them, or you have to have a small amount of them. It can be on a case-by-case basis. They can be a little bit helpful or totally like off the table for people. So spore probiotics are cool. And as a general rule, I'd say like you could say that a spore probiotic is going to be stronger than another probiotic. So my recommendations there about whether I recommend a spore probiotic, whether I think they're good or not, is again going to be very individualized to you and to your health situation and your experience with probiotics. And in this case, because you're in this program, what your GI map tells you and how well you respond to your GI protocol and sort of what Carrie has recommended for you going forward. So I would not recommend that most people just grab a spore probiotic and like start taking it and see what happens. If they have no history of any kind of GI dysfunction, if they have no inflammatory kind of like autoimmune issues, if they have no sort of like weaknesses and sensitivities, issues related to foods, things like that, then yeah, a healthy person who just walks into a store off the street with no particular health concerns could certainly just try taking a spore probiotic, as long as they already had a very healthy, like balanced diet. But for most of you guys who are in this program, who have the benefit of the GI map, I don't think that I would just recommend that you immediately start a spore probiotic. I would go through the GI protocol first, and then if Carrie thinks you can handle a spore probiotic, maybe it's what she'd start you with right away, but more likely we'd start you with something else and see how you respond to it, and then we could consider moving up to it. And you may or may not need it. Another thing about all of these things is that they are called supplements for a reason. They're not called primaries, right? The primary source of nutrition for all of us should be the food that we eat. That's why we focus on diet so extensively. The primary source of all of the micronutrients and all of the special nutrients also really should be the foods that we eat and the way that our body processes them, right? So we do want to protect our GI system's ability to break things down and absorb things. So we don't want to just take fistfuls of pills of anything that, you know, anybody's ever heard of, because that can impair your body's ability to absorb what's in the pills and what's in your food. So that means, like, there are some people who probably do better without a probiotic. Their gut microbiome is really strong and the way that they eat promotes that, and they're totally fine. Most people do better with a probiotic, but you may never need the strongest probiotic. You may never need a spore probiotic, because if your body gets the assist from something else, that's fine. Ultimately, we're not trying to create a situation with the probiotic. We're trying to support the situation that already exists in your own body, if that makes sense. It's supplementary, it's not primary. Next question is very short. I would like to confirm that I should only be taking 1 capsule of the Gold serapeptase daily. So these proteolytic enzymes or systemic enzymes, the one that we tend to recommend the most, but that is out of stock and has been for months and months now, is Wobenzyme N. It's a German enzyme blend, and it has a lot of research behind it, including research related to pregnancy and pregnancy loss. It is manufactured by 2 different manufacturers here in the US, Douglas and Garden of Life, and both of them have been out of stock for a really long time. Serapeptase is a single enzyme. It's exactly an enzyme, but it's a single thing. So instead of being a blend like Wobenzyme, which if you looked at the ingredients on the back panel, there are multiple things in it, serapeptase is pretty much just one thing. But it also works as a proteolytic or systemic enzyme in the body. And what that means is that it dramatically reduces inflammation. So the dosing of Wobenzyme N on the bottle is 3 tablets on an empty stomach 3 times a day. We find that most people do very well with 3 tablets on an empty stomach once a day. And so we generally don't recommend more than that. Now, for certain people with certain situations, we may recommend it twice a day. We don't usually go further than twice a day with the Wobenzyme N, not because it's so strong, it's so scary, you know, you have to be so careful with it per se. Although if you are taking a baby aspirin, I want you sticking to only 1 dose a day, because it also has a blood thinning effect, and we just don't want to like do too much blood thinning. Unless you're on like an injected Lovenox during pregnancy and being monitored by a doctor, you're doing blood work and things like that, that's different. But so because we recommend a baby aspirin while you're trying to conceive so frequently, we also tend to keep the Wobenzyme to 1 dose of 3 tablets on an empty stomach per day. The 3 doses that's recommended on the bottle of Wobenzyme is challenging, because if you're taking other supplements, if you're taking any other medications, especially if you're taking a thyroid medication where you have to have, you know, a certain amount of time after you take that before you eat or take anything else, there's not enough time in the day to live a life, have a job, take care of kids, you know, not go insane, and also track all the timing between when you can take something, when you can eat something, when your stomach has to be empty, so on and so forth. And so taking the Wobenzyme on an empty stomach 3 times a day usually is just too much for everyone. So Wobenzyme, 3 tablets once a day on an empty stomach. In certain cases where we have specific reasons for doing it, it might be twice a day on an empty stomach, but that's really it. For the serapeptase, their dosing is different. It's just 1 capsule. So you can think of, if you were taking 3 tablets of Wobenzyme and you had to switch to serapeptase, to Seragold, specifically serapeptase, your 3 tablets of Wobenzyme is 1 dose. Your 1 capsule of Seragold is 1 dose. You're going to take however many doses you were taking of the wobenzyme. So if you were one of those girls who does take 2 doses of wobenzyme, then you are going to take 1 capsule twice a day of the Ceregold. If you were only taking 3 tablets once a day, you're only going to take 1 tablet of 1 capsule of the Ceregold. If you hadn't transitioned over from wobenzyme and you've started with Ceregold and it's your first experience, we'll do the same thing that we would do with the wobenzyme. Most people are probably just going to take 1 capsule once a day, also on an empty stomach, but some people might take 2 capsules twice a day, or sorry, 1 capsule twice a day on an empty stomach, which means 2 capsules total per day, even though I think the bottle also says that you could do 3. And it's for the same exact reasons that we're not going up to the 3 and that we're managing how many people are on the 2 doses because of baby aspirin, because of blood clotting factors, because of timing everything and not going crazy. So if you are taking 1 dose of Ceregold, one dose of Ceregold is 1 capsule, and that's great. If you were taking 3 tablets of wobenzyme, taking that one capsule of Ceregold is equal because each of those is a dose of that enzyme. If you were taking 2 doses of wobenzyme, or if your coach wants to put you on 2 doses of Ceregold a day, that's also fine. Part of what's so great about this program is you can ask these more general questions here, and then you can ask this very specific question of your coach, me or Heather or Amy. Do you think I should take more than 1 dose of Ceregold per day? Right? And then based on everything else that you're taking, where you are in the process of getting pregnant or doing transfers or prepping for transfers or prepping to get pregnant, what's going on in your GI protocol, etc., we can say whether we think that you should increase to 2 doses a day. But 1 capsule equals 1 dose. And so if you're taking 1 dose, 1 capsule is sufficient. And I think that that's the full list of questions for today. Like I said, I think it's probably shorter than it's going to be in the future because this is brand new and this is the first session. We do have a couple of extra minutes. It's only 9:48, so I have 12 more minutes. If anybody wants to put a question in the chat, or if you want to come on the Zoom and ask a question, I may not always be able to do that in the future, but I'm happy to do it now. And if you don't, that's okay. I will probably end a little bit early so that we don't just sit here in silence. But I will give you guys a minute, to decide if you want to ask something. If you want to ask something and it's going to take you a couple of minutes to type it up into the chat or something like that, just tell me in the chat that you do have another question and I will wait for you. Okay?
Hi, Sarah. I have a question, if that's okay.
Of course. Is it Serena?
Yes. Do you want me to turn the video on?
You don't have to. Whatever's comfortable for you.
I'll just turn it on. I don't have any makeup.
I don't either. And my hair's all wet. It's early.
Well, I'm like trying to get my son out the door for his vision therapy, but I'm sorry. I meant to put a question in. It just slipped my mind. I thought
Don't worry about it.
So my question is, 2 weeks ago, with our 3-day transfer, something that's kind of been like not sitting well with me is they had to change the catheter because of my C-section scar. And when they inserted the catheter, they kind of were making comments of like, oh yeah, look how it was like, it looked like it was off-roading. And then it went easy after that. And they were able to, I mean, no comments were made.
They already had the embryo in the catheter and they tried to insert it through your cervix? No.
So it was the initial catheter before. It was almost like they put a tube and then so they had to switch it to a different, like,
smaller, probably.
Yeah. And I'm like, is that impeding our chances like every month? Like,
so that is a really good question, and it really depends. So cervixes are not, in my head, back in the day, I used to think of a cervix almost as like a manhole cover, you know, kind of
Okay.
like a very thin, sort of like flat little flap or door or something, right? I mean, it opens almost like a drain. It opens like a circle instead of flipping up. But they are actually they do have thickness to them. They are not just a single sort of like layer. And so there are some women whose cervixes are a little bit unique in shape, and the pathway through the cervix isn't always the expected kind of like straight pathway. So there are some times where the physical form of the woman's cervix make a procedure difficult, but they should not be impeding sperm getting through, because it's more about the doctor pushing the thing through than it is about the thing being a semi-permeable, you know, cervix that can allow sperm through. In those cases, often anything going in any kind of procedure causes the girl pain. So she has an IUI and it hurts. She has, you know, anything, and she like that she has more pain than other people would have, but because it's you only experience yourself, you don't really realize that other people aren't having pain. So in those cases, they can do a mock transfer beforehand, where the person who's going to do the transfer can do a test run, and they can just guide that initial catheter sort of like through the pathway, and then they can make notes on it, or they can record it so that they can watch it and see how they're going to do it, so that on the day of, they already know what they need to do. And I would say that in those cases, we're not expecting that that means that it's impeding your ability to get pregnant every month. Now, there are some people who have other things going on with their cervixes. So you can have what's called cervical stenosis, which stenosis is related to like the root stone, right? Which means hardening of the cervix. And in those cases, it may or may not impede natural conception, but I do have concerns and questions about whether it could. So it is something to talk to your doctor about. Did you see signs of stenosis? Do you have concerns about this?
Okay.
And there also can be little polyps that grow on the outside of the cervix. They're usually really small, but there can be one or two of them, but there could be a whole bunch of them. And those can also impede the sperm getting through the cervix, impede the normal functioning of the cervix. So sometimes it's just that the person who was doing it in the procedure is newer or less experienced, or just chose the wrong thing, or on that particular day you were just a little bit tense, because there are muscles involved in this. So if you were to do another day 3 transfer and you didn't do a like a trial run, a mock transfer beforehand, you might ask them to give you a Valium, because Valium is an anti-anxiety medication that's also a muscle relaxant. And that might make it so that your muscles contracting aren't also contributing to this kind of being a problem. Does that make sense? I can't, yeah, I can't.
And we did do, can you hear me?
Yes, now.
We did do a trial transfer last year, and my RE was asking if I like had,
Now you're breaking up.
if I had had a colposcopy or something.
So
Oh,
a
sorry.
colposcopy is a procedure where they take a
Okay.
sample from your cervix to do a biopsy on.
And yeah, and I did have one when I was in college. So he just like had noticed that, I don't know, something about my cervix. And then but that was last year. And with my son, I did have difficulty dilating, so I don't
Well,
know.
during delivery, especially a first delivery, I don't know that you can take that difficulty dilating as something that is
Okay.
it is, you know, is related to the functioning of your cervix outside of the first pregnancy, because pregnancy delivery for the first baby tends to go very slow, and the dilation tends to go very slow. If they said, oh,
Okay.
this is unusual, this feels like a problem, then I would say that's more. But I
Okay.
would have a follow-up with your doctor. Now, I mean, I think I would have a follow-up
It-
with your doctor anyway, and I would ask them,
Yeah,
tell
it's
me more
scheduled for
about
next
what
week.
happened with my cervix. I want to make sure that I understand why you guys had the problem that you had, why why you needed to switch to a different catheter. And then did the mock transfer that I had last year factor into this? Like, is that something where before another transfer, you guys would be able to review that again? Or would it be a good idea for us to plan for a mock transfer again before doing another transfer, just so that you know, even if you never do another one, you know what you would be expecting and asking for? And then also specifically, I also am really, I just want to make sure that you didn't see anything or experience anything that would suggest that this could impede natural conception. Yeah, because I do think there are a few cases where it could, but the majority of cases, I don't think I'm concerned about that. Does that make sense? I don't think I can hear you when you're in the garage, but I know you have to get out the door. So that you're totally fine, Serena. If you have any other questions, just let me know, because you know where to find me. And have a really good day. And Emily, you have a really good day. And anyone who's watching the video, you have a really good day on whatever day that is that you're watching this. And I'll be back in a month and we'll do this again. And I really enjoyed this. So have a great day, everyone. I'm gonna end the Zoom for us. Okay, bye.